Today we learn HBA1C, a blood test that is regularly required in patients of diabetes mellitus. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. What do you mean by glycated hemoglobin? So, glucose is a sugar and is a primary fuel for the body. It binds irreversibly to hemoglobin in the RBC and it persists for the lifetime of RBC, which is approximately 120 days. This hemoglobin bound glucose is called glycated hemoglobin, and the levels of glycated hemoglobin increase with uncontrolled diabetes. So a blood sample is taken. It may be done anytime. Fasting is not required, and blood taken from veins is used. Arterial blood is not required. It gives an estimate of last 3 months of blood sugar, as the lifespan of RBC is 120 days, which should be ideally 4 months, but yes, it is more accurate gives of last 3 months. What is HbA1c? So technically it is a non-enzymatic condensation reaction between glucose and the N end of the beta chain of the hemoglobin. Now I will not go into the details, but the only important word over here is non-enzymatic. Longer the hyperglycemia, higher the glycated hemoglobin. So a person who's got hyperglycemia for 3 months will have more high glycated hemoglobin than the person who has had it for 1 month. Timing of test. It reflects more on the recent blood sugar, and 90 days proportionally will reflect more on the recent 30 days blood sugar than the previous 60 days blood sugar. So if a person consumes lots of sugar in the week previous to the test, he will be higher than if he had consumed the same amount 2 months ago. So today, say we take a patient takes the test and last 7 days or 10 days he consumes a lot of sugar, and the same sugar had another person consumed 2 months back, and after that he's maintained his sugar, then the glycated hemoglobin will reflect more of the last few days than the previous 2 months. Normal range. So less than 5 to 0.7% is normal, 5.7 to 6.4 is pre-diabetic, and greater than 6.4% is diabetic. Now this is for people who are not on treatment, and below between 5.7 to 6.4 may be acceptable for diabetic patients on treatment. Untreated prolonged diabetes levels may go up to 15 to 16% or higher. Uses. It is helpful in the diagnosis of pre-diabetes, monitoring of diabetes. Fasting levels are better for making treatment decisions. So what actually happens when patients come to doctors with a single blood test other than HbA1c, random blood sugar, FBS and PLBS, they generally fast for a few days before getting the test, and there is a tendency to deceive the doctors, and after that they show the doctors they start consuming sugars again. So what if HbA1c gives you a better average, but still fasting levels are better for making treatment decisions. When to do the test? Whenever there is a suspicion of diabetes, confirmation of diabetes is done. Single blood sample may show increase in blood sugar due to various reasons and increased HbA1c. There is something called as stress-induced hyperglycemia also, so that if after an accident a patient's blood sugar may rise. So a single blood sample may show increase in blood sugar. So if you do HbA1c, this will show a sugar. If it is high, it confirms the presence of blood sugar, and again it shows helpful in monitoring the patient compliance. Control of HbA1c. Well then, you have to control diabetes. It can be achieved by diet, exercise and medications. So preferably we take the diet and exercise first, and if it is not controlled with diet and exercise, then we can put up medication. I have already put a video on diet and lifestyle modification in diabetes. Fallacies. So, if the RBCs have a shortened lifespan, the report, as it occurs in some conditions, then it will cause false readings. Again, vitamin B12 deficiency and folate deficiency, the cells are bigger and they have a prolonged lifespan. If the patient has received blood donation or transfusion recently, again the report may not be accurate. If there has been a recent blood loss due to any surgery or due to any accident, again HbA1c may not reflect the right. Patients having chronic liver disease and kidney disease, HbA1c is not very accurate in them. High dose vitamin C, erythropoietin, again it is not very helpful if there is a change in diet in previous 6 months, change in diet in previous 6 weeks, or this pregnancy. So these things we have to rule out before we go for the test. And again in iron deficiency anemia, it may not show be very accurate.